Hello, and welcome back to the Dr. AKINDE Breaks It Down video series. Today's episode is episode 3, diarrhea, and maybe some vomiting included in there. This is the gastroenteritis talk. Now, diarrhea can actually be a pretty complex topic. It's something that can happen as a result of infection, but it can also happen for other reasons. For the purposes of this discussion today, I think we should limit it to infectious diarrhea, something that happens commonly in kids, multiple episodes even, and it can be quite a little bit of a concern for parents. So, what is diarrhea? Diarrhea is essentially excessively liquidy or watery stool. Stool consistency can vary. It usually varies based on diet, varies based on the hydration status of the child as well. But also, of course, whether or not somebody has an infection. But generally, the consistencies that are acceptable are pretty soft to firm, but not hard. So essentially, diarrhea is when it gets watery or very liquidy. So then the causes of diarrhea are the things that we should kind of think about. First of all, today's t-shirt brought to you by NASA, because science. Now let's get back to the topic. So today we're going to discuss diarrhea, which is this infectious condition that most of the time is caused by viruses, but it can also be caused by bacteria. And then also in different parts of the world, it can be caused by varying parasites and things like that. For the most part, we'll focus on the viral and the bacterial causes of diarrhea. First of all, it's really important, especially with topics such as this, to make sure that you're not taking this as medical advice. This is medical information. There might be parts of it that don't make sense to you. There might be parts of it that are omitted for the sake of simplicity. So I don't want you to think that I'm telling you either to go see your doctor or not see your doctor, or to take a medicine or not take a medicine. It's really important for you to consult a medical provider for any illness that you have. This is a really, really important thing, all right? But this is information that hopefully helps you make good decisions for your child for the most part. So diarrhea is this condition that involves stools that have excess water in them. And of course, if that excess water is in the stool, that means that excess water is not in your body. When the water's in your body, we call that normal, proper hydration. So as you can see then, if you're having diarrhea, you can become dehydrated. And dehydration in and of itself is another potential topic of conversation that kind of requires its own process of care. So diarrhea can lead to dehydration, which is one of the important things that make us want to make sure that we have it last as short a time span as possible. Potential causes of viruses, as I said. Rotavirus is the most common cause of diarrhea around the world. Luckily, there's a vaccine that's available around the world to fight against this. And here in the States, we've seen a dramatic drop in the number of children infected, number of children seen in the emergency room and urgent care facilities, number of children admitted into the hospital, and number of children who were treated in the intensive care unit. Diarrhea and dehydration can lead to an intensive care unit admission if a child is dehydrated enough. So it's not nothing. Usually diarrhea is something that lasts 3, maybe 4 or 5 days. It can last over a week, and in some cases 2 weeks, without it necessarily being anything else. But if it lasts over a week, you should definitely see your medical provider. Even before then, if you see anything else that's happening. This is simply something that you don't want to mess with or sit on for a long time. So 1 or 2 days in a child who's a few months old to years and years old can be observed at home to watch the kids' pep and energy level, their comfort level, whether or not there's blood in the diarrhea. Any bloody diarrhea needs to be seen immediately in the emergency room. As well as ability to drink. Because while someone may have diarrhea, they may also be able to drink and therefore balance the losses of fluid with the amount that they're taking in. So if they're taking in a good amount and not vomiting along with the diarrhea, eventually we expect the diarrhea to self-resolve. The diarrhea that usually requires antibiotic medicine is bacterial diarrhea, essentially dysentery, because it often causes bloody stools. And with that, the bacteria themselves can be part of the normal gut bacterial flora. The intestines particularly our large intestine, contain bacteria in much greater numbers than there are actually cells, human cells in our body. So we're actually mostly walking prokaryotes instead of eukaryotes. Tried not to leave the big words, but I have to prove how smart I am. So no, I'm just kidding. But anyway, that's some trivia stuff for you if you want to throw that on somebody, that there are actually more bacterial cells in our bodies than there are human cells. So the gut contains a lot of bacteria, and sometimes these bacteria can overgrow in different ways. It could cause diarrhea, it can cause dysentery. So bacterial diarrhea is usually dysentery. It involves sometimes bleeding and can need antibiotics. But again, this is a decision that a medical provider has to make, because sometimes antibiotics themselves can make the problem worse. So this is a really, really important thing to remember, not to go in there demanding and asking and saying, hey, this is a bacterial infection, I'm supposed to take antibiotics, give me antibiotics or else. Instead, make sure that you're asking questions and accepting the information being provided as well. So, generally, the treatment for diarrhea is hydration. And hydration can be achieved, I prefer, especially in children, hydration to be achieved by more than just water. What's the calorie content in 1 drop or 1 gallon or 1 ocean full of water? Put that there, like that. It doesn't give you any calories for your body to use. Therefore, a kid loses energy through the day and through the time of illness. Instead, there are oral rehydration solutions available, various types around the world, generally here in the States and maybe in other westernized areas and more. There are solutions of Pedialyte that come in different flavors. It can come as a powder packet to be mixed with water, exactly as recommended, not skimping on water or adding too much water, because that can change the electrolyte balance in the body. And so follow the instructions on a Pedialyte container, or just buy the liquid Pedialyte. I like to recommend that if the kid doesn't like the taste, you can add just a little bit of fruit juice, just a little bit of ginger ale or something like that, just to kind of cut the taste so that they are more willing to drink it. There are also Pedialyte popsicles that can be frozen and that the kid can just have fun eating, which then hopefully replenishes the fluids that are being lost in their body. And then other treatments that may or may not help, which people bring up, are these over-the-counter treatments like Maalox, Mylanta, kaopectate, etc. I usually try not to recommend any of those. The reason simply is this: any medicine that you give to stop diarrhea could actually keep the offending agent, the viral agent. Viruses don't really belong in our body. So if you're keeping a virus inside your intestines, the illness is just gonna last longer. Sure, you may have stopped the diarrhea for a while, but then actually you get sicker. There are other implications for that as well, including cost. Things like probiotics. Please listen to me closely. I know a lot of people believe in probiotics. I have yet to see good evidence that probiotics are effective. I know they're expensive, but I haven't yet seen evidence that they're actually effective. So what I'd ask is, don't worry about probiotics. They don't necessarily do anything for you. The contents of them, bifidobacteria or something of the sort, generally don't make a big difference in terms of your gut flora. Your gut flora very often can replenish itself. And I'm hoping, honestly, I get a lot of statements and comments on the video based on that, simply because I know that a lot of people believe in it. And I want them to show me the evidence of the effectiveness of probiotics in well-done studies, even in not so well-done studies. The information is still really lacking. I've had a few conversations with GI docs where it wasn't really something that they preferred, but they kind of gave in because people believe in it so much that they don't want to necessarily offend people. I'm not trying to offend anyone either, but I am saying this: if I don't see that something is effective or proven effective, I'm not recommending it. Probiotics fall in that category. So that really is the summation of the treatment of diarrhea. Now, if it involves vomiting, we also still have to make sure that somebody who's vomiting, especially if they have diarrhea as well, is watched very closely, because it's like a double-edged sword. Essentially, the person can have fluid coming out of the front end and the back end, and so they get dehydrated faster, which could mean an immediate need for IV rehydration. There are ways to hydrate somebody through their mouth if they are vomiting, but it involves giving small sips of fluid, such as Pedialyte, small sips frequently. The nausea that we feel has in some ways to do with the stomach's baroreceptors, which feels kind of the fluid pressure inside the stomach. And so if you're not causing the stomach to feel bloated by chugging and guzzling a drink, if you're taking a few sips every few minutes, then it bypasses essentially that feeling of bloatedness, goes into the intestines, and helps to improve rehydration of the body. But if a kid or a person just can't take anything and keep it down, then it's important to just go and get checked, because IV fluids may make a world of difference in terms of perking them up, making sure that they're urinating. So the kidneys are kind of a pinwheel mechanism. They start to shut down if you don't have enough fluid inside your body. So you have to be well hydrated today, tomorrow, always. And one of the best ways to do that, of course, is as with rehydration, is using Pedialyte or other oral rehydration therapy. So let's stop there. We can always add more content later. I'm going to ask you please to like subscribe, share this video. It's really important. I still have big goals to grow the channel and get these topics out there to as many people as can benefit from the information being provided. I hope to have subscribers from this area, Chicago, through the United States. I have a few friends and family in other parts of the world, and I hope that some of those people and those people's people also tune in, so that maybe if something is applicable to them, they can also benefit from the information. And then anyone else who needs it, of course. Please leave a comment for any concerns that you may have or any further questions, and I appreciate you stopping by. Thank you.